Give the call to member for Blair.
Thank you, Mr Speaker. My question is to the Minister for National Disability Insurance Scheme. How is the Albanese Labor government cleaning up the coalition's mess in the NDIS after the former government allowed NDIS participants to languish in hospital when they were medically ready for discharge?
Give the call to the Minister for the National Disability Insurance Scheme and the Minister for Government Services.
Thank you. As all members of the House would know, when the NDIS works well, it's life-changing. But when it goes poorly, it can be traumatic for participants. The fact of the matter is that the last election, there were real problems with the NDIS, and all members deal with that. There was fraud, red tape, ballooning costs. But I think that there was no worse problem than bed block. The fact that when we had people with disability eligible for the NDIS, medically fit for discharge, they couldn't leave hospital because there was no place for them to go. There were extremely long waiting times between when someone was medically fit for discharge and when they could actually get out. The Victorian Hospital Authority calculated that before the last election it was about 160 days between when an NDIS participant was medically fit to be discharged, but another 160 days before they could be helped. That's too long. The reality is that this was costing the hospital system, it's blocking the beds, and it's a very poor outcome for NDIS participants. We promised before the last election time to cut the waiting times between fit for discharge and discharge, and we have. Promises made, promises kept. We've cut the red tape, we've put more people in to help wrangle the issues, and we've also given greater delegation to people closer to the hospitals. I've had the ability to visit hospitals in Western Australia, in Canberra, the Alfred campus at Caulfield. Marvellous staff and their resilient patients. The good news is that the waiting time, which was 160 days before the election, on average is now down to 33 days. The AMA calculates that this is saving the hospital system already somewhere between $205 and $584 million. That's in the order of $500 million. It's good for the hospitals, it's good for people who need to access hospital beds, and it's fantastic for people with disability who have been kept waiting longer than they otherwise should have. And what I say to Australians with disability and the people who love them, that this is only the beginning. The NDIS represents what's best about Australia. It's about helping others who are in trouble. It's about not leaving anyone behind. If we can't look after people with profound disability and their families, what kind of country are we? We are lucky enough to be able to not exclude from the opportunity of this country people with disability. We all should be proud of the NDIS. Shoulder to shoulder with Medicare, it's one of the best purposes we use our tax dollars for. Under this government, the NDIS will enable Australians, regardless of their impairment, to have lives of dignity and control, to have lives where they can make a contribution to community, a life of improved health, and that's our purpose.